Good morning, everybody. Thanks so much for bearing with us. We had some technical difficulties, but super excited to see you all this morning. I'm going to go ahead and kick us off. We got a lot of good info to cover today. So my name is Haley Bell. I'm the training program manager with Telehealth Rocks, and I will be facilitating today's session. Super excited to have you guys here for the 9th session of our Echo Light training series, supporting the whole child, connecting brain health systems and practice. Next slide, please. I think we went a little too far. We can go back a few slides. There we go. Awesome. Okay. So before we jump in, I just want to take a moment to remind us kind of what the series is in case it's your first time joining us. So it is an ongoing twice monthly learning series really designed to build over time. It's grounded in the whole school, whole community, whole child framework, which really provides us with a shared way to think about how systems connect around and support children. We also want to make sure these sessions are interactive. So each session, including today's, has a case-based approach, really creating an environment where we're able to learn together, but also from one another and hear your all's expertise as well. The series is also designed to have multiple disciplines and perspectives. So you'll see today that our two speakers, Gwen and Allison, each bring their own perspectives and really planning to carry this throughout the remainder of the series as well. And finally, everything that we will talk about in the series is focused on real world practice and collaboration. So really making sure that what you guys learn in each session is able to be applied in your day-to-day work or life. Next slide, please. All right, so super excited to get to introduce today's speakers. First, we have Gwen O'Brien. Gwen is an accomplished nonprofit executive and licensed clinical social worker with more than 20 years of experience advancing child welfare, strengthening nonprofits, and leading systems level change. She currently serves as executive director of the Park Hill School District Education Foundation. Previously, Gwen served as executive director of Feed Northland Kids, where she guided a strategic planning process that aligned the organization's mission, programs, and priorities with emerging community needs. Earlier in her career, Gwen spent 2 decades in child protection services in Alabama and Missouri and held senior leadership positions at Synergy Services, providing leadership for advocacy, intervention, and prevention initiatives. Throughout her career, Gwen has championed trauma-informed practices, collaborative leadership, and community-centered solutions that create lasting positive outcomes for children and families. So super excited to have Gwen here with us today. We're also joined by Allison Hilton. So Allison is the operations director for our own program, Telehealth Rocks. She brings more than 15 years of experience in nonprofit leadership, youth services, advocacy, and community-based systems work. Prior to joining Telehealth Rocks, she served as vice president of youth services at Synergy Services, where she oversaw multiple programs, operational strategy, compliance, funding, and interdisciplinary teams. Her career spans direct youth advocacy, leadership, policy work, training, and community partnership building. At Telehealth Rocks, Allison helps create the structure and support that allows the team to do our meaningful work well. She's passionate about supporting children and youth by understanding their strengths, their resilience, and their ability to grow. Super excited to have Allie here with us today as well. Next slide, please. So just before we jump into today's session, I do just want to take a moment to acknowledge that we will be discussing some topics that might be difficult or sensitive, including abuse, neglect, violence, substance use, mental illness, parental separation, and incarceration. I also just want to give like a brief overview of our session. So we will define adverse childhood experiences or ACEs and review all of the 10 ACEs. We will also examine the impact of ACEs and how they impact children and adults' health, development, and wellness. Next, we will explore how resilience complements our understanding of ACEs and supports positive outcomes. We'll also identify the role of supportive relationships and protective factors in healthy child development. And finally, we will review practical ways schools, family, and community partners can build resilience using the whole school, whole community, whole child approach. And then for our WISC components that we're covering today, we'll mainly be in the social and emotional climate, as well as counseling, psychological, and social services. Next slide, please. So before I hand it over to Gwen to get us started, just a quick review of our learning objectives for today's session. By the end of the session, you will understand the adverse childhood experiences study and questions associated with an ACE score. You'll also leave with understanding of the impact that adverse childhood experiences can have on health and wellness. You will be able to describe how resilience and protective factors can buffer the effects of ACEs and support healthy social, emotional, and academic development within the WISC model. And finally, you will be able to identify at least 3 evidence-informed strategies that schools, families, and community partners can implement to strengthen resilience and create safe, supportive environments for children. And with that, we'll go ahead and go to the next slide, and I'll hand it off to Gwen to get us started.
All right, wonderful. Thank you, Haley. Good morning, everybody. Thanks for joining. I'm just going to start off by giving a little bit of an overview of ACEs and the Adverse Childhood Experience study. So it started out in California. Dr. Vincent Folletti was out there at an obesity clinic and was working with adult obesity clients, and realizing that they were maybe doing really well, really starting to lose weight, would be successful for a period of time, and then either stop coming to the service or have some sort of thing that would happen where they would make a right turn and head back into gaining weight and putting that weight on. So he's doing some work. And when I think back on this, and I think this is only the 90s, it feels really weird to me because it feels like maybe we should have known some of this stuff a long time before that. But so he's working with these folks and starts doing some assessment of what was happening with them. What's going on, what changes in your life have happened, and the reasons that you are, stopping treatment or putting the weight back on or whatever that is. And what he found was that there was an abnormally high number of people that described childhood sexual abuse. And, if you've ever watched a video from him when he talks about his early work, he says, I just couldn't believe that there was that close of a connection between obesity and childhood sexual abuse. And he thought, surely I would have learned that somewhere in medical school. And so he went back and back and back and back and started talking to peers around the country. And it really developed into this process of researching all sorts of childhood experiences. They eventually then came up with the adverse childhood experiences, title of that. But it was really started from just saying what's going on with these adults, and they're having these health outcomes that are concerning. And what we find is that they're tied to some of their childhood experiences. And so they ended up doing a study in Southern California, over 17,000 people. And it was mostly white middle-class American people that were in that study at the time. Since then, they've done all sorts of studies, but that was the population they were looking at. And they surveyed them about a number of different kinds of experiences in childhood to see what kind of correlation there was to health outcomes as adults. You can go to next slide. So where they landed is these 10 adverse childhood experiences. And what's really important about this group of 10 is that this is really up to each person to determine if they experienced these 10 events. So I think of this sometimes like when they do those little surveys online that are like, how many states have you visited? And some people, like if you drove through a state or if you've even been to their airport, you'll give yourself a 1 point for it. And other people are like, only if I've actually been to that state and like toured and done something, spent the night there or really done something active. So that's true here too. For physical abuse, you can say, I get to decide if anything in my childhood from the age of 0 to 18 qualifies for me as physical abuse. Maybe I was spanked and I don't count that. Maybe I was spanked and I do count that. Maybe I was slapped one time and I count that. Maybe I was slapped one time and that was a one-off thing that doesn't matter. So it really is about how the person perceives their experiences from 0 to 18. It's no one else saying, well, if this happened to you, then that qualifies. That's really true as you look through this list. So physical abuse, physical neglect, how much food you might have had to eat, how much secure housing you had over your childhood. That's something that a person says for themselves. I feel like I had, physical neglect in my childhood. Household member suffering from mental health issues, right? That's a huge, broad spectrum. So, maybe I had a parent who had some postpartum after a sibling was born. Do I count that? Was that impactful to me or was that not impactful to me? I had a parent who was bipolar and that was really impactful to me. Okay, then I'm going to give myself a point for that. So the ACEs, Adverse Childhood Experience Assessment, is looking at these 10 areas and giving yourself 1 point per area if you have that. So the score is a collective score. It does not matter which of the 10 or all of the 10 or 6 of the 10 or whatever that is that you choose. But again, it's about whether you identify that experience as a yes or a no. Loss of a parent due to death, divorce, or abandonment. So losing a parent, maybe not ever even remembering them. Maybe they were gone by age 6 months and you don't remember them, but it didn't really have a huge negative impact on your life. Maybe there was a step parent that came in. That's really who parented you and you felt, loved and cared for. Maybe that's not a one. For somebody else, that loss of a parent at 6 months and maybe the parent remaining had a really difficult time with that over the years. And so then that does give somebody a reason to score that. So it's a really interesting list of the adverse experiences, and it's all about determining which of these impacted people as children. So there is a childhood version of this where children can score themselves. We certainly want to know as they're growing up if they're having any of the experiences. And on the preventative end, we're trying to prevent all of these things, knowing that they cause poor health outcomes. They have the potential to cause poor health outcomes in adulthood. So we really want to prevent, but a lot of this is about doing an assessment as a person 19 and older about which one of these or any of these that a person might have had and what that means for your health outcomes as an adult. And I know Allison will talk later about resiliency. So it's not an automatic. If your score is 4, if you say there's 4 of those blue bubbles that have happened to me, my score is 4, it's not an automatic, then I have these diseases as an adult, or I have these risk factors as an adult. There are resiliency factors built in. There are all sorts of things that happen. For me, what I feel like how this changed the way that I practice social work and how this really impacted is really along the lines of this trauma-informed care model, which is, I wonder what's going on with you. I wonder what's happened to you in your life that is having you present to me this way today in this classroom, in this clinic, in this therapy session, whatever that might be. What's going on? And I really just want to be curious about it. The other really important piece of this, and I think I've maybe kind of said it a few times, is it really doesn't matter which one it is. So if you say I have an A score of 4, I don't have to know. Tell me which of the 4 blue bubbles that you're scoring on. I just know that because you've had a combination of things, your risk factors are a little bit higher. You can go to the next slide. So here we talk about that graded relationship. So the adverse childhood experience has found a graded relationship between the number of adverse events and an increased adult health and disease outcomes. So not necessarily the number of like how many times was I physically abused, but if I was physically abused and I count that as one of my 1 ACEs, then that's 1. So if I was sexually abused, and there's no doubt that one-off events of something is impactful, and it's differently impactful than chronic events. So we know chronic physical abuse, torture cases, some of the really hard ones, those have an additional impact. The reality is for this study, if you've marked 1, 2, 3, 4, 5, 6, whatever it is, it has a prediction for health outcomes. It really doesn't account for whether it was chronic or not. We know that there's other things that get impacted by chronic abuse. But in this particular study, this is about the number of ACEs that a person has selected. So there's those really strong predictors of health risk and disease from adolescence into adulthood. And we're going to look at it in just a second. Some of it, when you see this, you go, of course, that's super obvious. That makes a lot of sense. People who have had childhood trauma, sexual abuse, a parent incarcerated, and a parent with mental health. So their A score is 3. When they've got their A score of 3, their likelihood that they are going to use substances is increased, right? Absolutely. Their coping skills are decreased. Their support systems might be decreased in those settings. And so it makes sense in that way. We get that. But it's also really significant that the health outcomes, the risk factors increase, increase, increase. And then we start seeing health outcomes like increased risk of cancer, increased risk of heart disease, not just increased risk of maybe risky behaviors. What's the word? Kind of the plateau part right here is 4 or more. So folks that have an ACE of 0, 1, 2, 3 have a lower likelihood of poor health outcomes and maybe increased risk of disease. 4 or more is where we really start seeing those increases. And it's important for adults to know that. I still live in this world where I'm hoping that someday I show up to my doctor's office, any doctor, I don't, my yearly physical, I don't know, a dentist, anybody that I show up to, and they want to know my ACEs score because they know that that's going to help predict my health outcomes. Right now, we all go to the doctor and we fill out how old are your parents, like how long, are your parents still living? Has anybody had heart disease? Do you have cancer in your family history? Did anybody die before the age of 50? All of those kind of things. An ACE score needs to be on there. It is just as predictive or more of poor health outcomes. So hopefully one of these days, the whole medical community will really get on board with understanding how important it is to know not just what sort of history you have of cancer. You could have no history of cancer, but a high ACE score, and now you have an increased risk of cancer. That might mean you need different levels of screening, right? You can go to the next slide. Okay, so this again just kind of says, this is a nice little graphic for that, that as you increase 4 and over, those the risk of negative health outcomes starts to significantly increase. You can do the next slide. These are a nice, lovely little chart that the ACEs community puts together about the possible risk outcomes. And again, Allison will talk here in a little bit about the resiliency end as we're trying to prevent and support people from being impacted by these health outcomes. Lack of physical activity. So, depression, not really doing a lot of movement. So increased risk of smoking, alcoholism, substance abuse, and missed work. And we're going to see, I think it's on the next slide, some impact on the economy that it has when we have people who are using substances, missing work, not getting a lot of physical activity. And then on the bottom part there, the physical and mental health risk outcomes. So severe obesity, there it is. It's right there, number 1. Increased risk of diabetes. You can start to see how all of these really interconnect too, right? So severe obesity and diabetes is there. Depression and your lack of physical activity or your alcoholism. Some of these are there. Suicide threats. All of those are already starting to interact with all of the other little bubbles there. Increased risk of STDs because we've increased our risky behaviors. Increased risk of broken bones. So again, we're somebody out here maybe doing risky behaviors, doing things like driving fast, having more accidents, different ways that people are going to get injured. Increased risk of COPD, increased risk of stroke and cancer and heart disease. So that kind of little group there that's increased. So again, my hope someday is that we will have medical professionals really taking a look at our ACE score to understand what sort of preventative testing, what sort of scans, what sort of recommendations and medications might be on the table when we consider what someone's ACE score is. Next slide. So this is just a quick slide to also talk about life expectancy. If you look at that last slide, we already know that risky behaviors and all of those health outcomes that we talked about are going to decrease life expectancy. So people with 6 or more, so we've been talking about the 4 or more, this now comes up to the 6 or more. 6 or more ACEs die nearly 20 years earlier on average than those without any ACEs. So those risky behaviors, all those things that we just listed on the previous slide are going to impact that. And then this is important for us, this bottom part of this economic toll. If anybody's writing grants, if anybody's thinking about legislative efforts and that sort of thing, this is also what's really important. The productivity loss, you see the yellow there is productivity lost. So increased ACEs scores resulting in all those risky behaviors and poor health outcomes equals billions and billions of dollars in productivity loss, The increase on the healthcare system is that next kind of the lightest green. The next one is the special education. The second to darkest green is child welfare, and then the criminal justice system. So there are areas that we can help our economy, that we can help our populations by doing all of the work towards preventing them or responding to our young people or even our adults now who have experienced childhood trauma. So with that, I'm going to wrap up and then hand it over to Allison, who's going to take this forward and talk. I kind of gave you the like bummer part of it, and Allison's going to tell you what we're going to do about it.
Great. Thanks so much. Appreciate the handoff. Yes, Gwen got to tell you the unfortunate news, but something that I love about the ACE study is that there is a good news caveat to that. So you can pop on to the next slide. And we're going to get into resiliency work. Something that I just want to compliment or highlight is that after someone enters into adulthood, the ACE score never changes. So when someone takes that ACE score, the number kind of just lives on as it is and the risk factors associated. But what we also know with research is that building resilience is the largest way that you can impact and kind of divert those negative health outcomes. So resilience is a science that gives us a path for a hopeful and practical path. Resilience is the process of adapting well in the face of adversity. And so a lot of this context and information about resilience isn't a trick or a gotcha. It's very straightforward. But if you're not elevating this information, sometimes we miss a lot of opportunities to build resilience in young people that we are around. Protective relationships, skills, and environments shift outcomes for youth that have high ACE scores. And it's important to also know that resilience is not a trait that people have or don't have. It involves behavior and thoughts and actions. And you have to be intentional about identifying resilience opportunities and building resilience in young people. The key point here is that a young person that has a high ACE score, their risky path can be diverted through resiliency work. And so when we have that information and can identify in a young person that they have a high ACE score, it gives us a better chance to intentionally look for those opportunities to build resilience within those young people. You can hop on to the next slide. So when we understand the risk of ACEs, it's when the good news can start and when adults can wrap around young people and step in and start supporting them differently because of that information. Resiliency can truly change the trajectory. It's really important to know that studies found that individuals with multiple ACEs who had high resilience, then later in adulthood, had the same positive health outcomes as someone with an ACE score that's lower or zero. And so it's really important to know that this path can be intentionally diverted. And that's the hope here. That's the resiliency work. Protective factors build resilience. We want to make sure that we're providing supportive relationships, safe environments, skills for coping to help buffer the impacts of adversity. Something that can happen when someone has a high ACE score is that they kind of live in that toxic stress state. So they have high cortisol levels in their body. They're not able to self-regulate. And so when we have those young people in our scope, in our community, it's our responsibility as adults to identify that and provide some buffers. You can hop to the next slide. One of the strongest protective factors is relationships. And so the good news there is that we can present as ourselves in these spaces with young people and start building resiliency on day one with them. Relationships buffer stress and help children build the skills needed to face adversity. Parents, caregivers, teachers, counselors, the list is kind of endless in terms of how you can present with a young person. Something that's important is to not get overwhelmed with that responsibility. When you are stepping into a role with a child to help promote their resilience, it does not mean that you have to solve every problem that comes your way in relation to the child. That's a big task. It can be small moments with young people. It can be brief moments with young people. It has a lot to do with being a consistent person in that young person's life. You can go to the next slide. This slide's going to tell us tangibly how we can build resiliency with young people. And if you want to, just hop in the chat and just kind of let other folks know in the room what your primary role is with children in your community. I think that might help with the discussion later, just to know who's in the room. Supportive relationships. So consistent adults notice, respond, and stay connected with young people. It's important to know that those one-offs, greeting someone the same way every morning, acknowledging them, commenting on their outfit or something that can build some confidence in them. Those small moments, I believe, are easy to recognize, but also easy to forget. And so we want to be taking opportunities for those moments with young people. Executive functioning skills. So planning, problem solving, flexible thinking. At times we can get into an adult mode. And so we're doing things on behalf of young people because we don't have enough time or we want it to be done right the first time. So it does take some patience to help support executive functioning with young people. But when we are with them, we do want to slow down a bit. We want to give them an opportunity to do something first. It builds confidence when a young person can have a small success. Self-regulation. We want to make sure that we are giving young people opportunities to talk about their feelings. We want to help them calm their body and manage the reactions. It is important with self-regulation to not teach while someone is in that heightened state, but making sure that we are taking the time to follow up and come back after a crisis is over or a moment of dysregulation is over to kind of process what that looked like so the young person can be better prepared the next time. Opportunities for mastery. This is kind of teased into the other categories too, but small wins that build self-efficacy and control. We want to make sure that we are giving choice. Young people want choices. It gives them autonomy and ownership over their environment and the things that are coming in their schedule. Belonging and hope. Noticing that young person that you see hasn't made a connection or can't identify a best friend. Those young people need to be identified and they need to be poured into differently than other young people who are not experiencing that difficulty. And then reducing stress burden. Safe routines, basic needs being met, and lowering unnecessary stress. Again, some of these things take pause and take time. I realize that in a day, you might not be able to do this with all of the young people that you're coming across, which is why it's important to get to know the young people. Like Gwen said, you don't have to know exactly what somebody's ACE score is or which category they scored in. But there are some intuitive measures that you can take to know that a young person is struggling and be able to intentionally find those moments to build resiliency. Next slide. This was an interesting, I think, complementary point to the ACE study in building resiliency. This is another avenue for young people to build resiliency, and that is positive childhood experiences. There is a direct correlation in adulthood, adults reporting how many positive childhood experiences that they had, and that lowering their risk factors for poor mental health. So as you can see, if an adult is reporting 0 to 2 positive childhood experiences, their risk for experiencing depression as an adult is higher, significantly higher than someone who reported 6 to 7 positive childhood experiences. Next slide. Thank you. So it's important to know that although there's this accumulation of stress that can happen within a childhood of someone who's experiencing a high ACE score, but we can also accumulate resilience in those young people. Again, young people who have high ACE scores, but also have a high level of resilience, can later in adulthood have lower health outcomes similar to someone who had an ACE score of 0, 1, 2, or 3. So this is where the work can begin. I'd love if you guys want to give thoughts in the chat throughout this slide and share information with one another or interact with the content. You, of course, can also come off mute if you wish. But I think it's important to identify what adults can do tomorrow. So what are some tangible things that you can start putting into place with young people as you come across them to intentionally build resilience with them? We're going to name strengths and effort before behaviors of concern. And so I know in some spaces this is hard to do, especially in the classroom when you're trying to manage crowd control and things like that. But oftentimes a negative interaction with a young person takes more than 15 positive interactions to counteract that as it relates to the relationship. So we do want to be mindful of that when we are addressing behaviors of concern with young people. This does not mean that young people cannot have consequences. It just means that we know after a consequence or a negative interaction happens with the young people, we have some extra work to do to build back that rapport. Regulating. Again, we want to make sure that we're bringing calm first and teaching skills after the child is settled. Predict. We want to use routines and clear expectations to lower uncertainty and build confidence. Young people, whether they know it or not, want high expectations. Young people are more likely to reach expectations that are clearly set for them. So when expectations or routines are ambiguous, sometimes young people have a hard time feeling safe or self-regulating in those spaces. So we want to make sure that we are giving cues for transitions, letting young people know what the agenda is for the day, or if it's a meeting session, how that's going to go, or what's coming in a doctor's appointment. Really taking that extra time to give that extra information to the young person so that they can feel safe in their environment. Connection is huge, big or small. We want to make sure that we're building authentic relationships with young people. Sometimes that means sharing power with them, which can be a little uncomfortable at times. And we also want to make sure that we're modeling repair. So if we do have a conflict with a young person, or maybe the adult is having a tough day and they have a miss with a young person, maybe they were too concise in their interaction. We want to make sure that we're going back to that young person and acknowledging that to build connection with them. Scaffolding is a skill to build with young people, and this means giving them opportunities for skill attainment that is attainable for them. So we want to intentionally give them opportunities to have successes and wins. This means in skill building, but also in leadership roles. Include. We want to give youth choice and opportunity over their experiences and environment when it's safe and appropriate. Something that I want you guys to consider is just a thought. What does this child need to feel safe enough to learn, connect, and try again? Next slide. Okay, before we kind of close and move into next pieces of our case presentation, I just wanted to give this visual just as like an ending note, is that adverse childhood experiences have two distinct paths that are research-based. There is a correlation. So young people who have high ACE scores, if we do not give them protective factors, there is a strong correlation to those negative life outcomes that Gwen went over. But the good news is that adults can intervene and we can provide those protective factors intentionally, build resilience in young people, and get them to those positive health outcomes similar to those peers that have lower ACE scores. So it is not a destiny. This is all information and good information. If you happen to want to share this information, you want to make sure that you're always telling both sides of the story. So when we're giving someone the information about ACE scores, we want to let them know about the content caution, and then we also want to give them the good news about building resiliency. Next slide. Haley, do we have time for this slide, or do we want to?
Yes, we definitely do have time. I think about 4 or 5 minutes should be good.
Okay, great, thank you. We're going to do a quick, I won't call it a quiz because I don't want to give anybody anxiety, but we're going to just do a quick review. If you guys want to put the answers in the chat or come off mute, that's completely fine. I will be kind and let you know that one of these questions is a bit of a trick question. So we are going fact or myth, and the first question is, resiliency is a personality trait that some children naturally have and others do not. So we want to know if that is a fact or a myth. I see a couple answers coming in through the chat. Myth. Yes, so this is going to be a myth. What we do know is that we build resiliency. So everybody has an opportunity to have resiliency built, whether they build it themselves or the community around them promotes that resiliency within them. And so we want to give an opportunity for everybody to build resiliency. The next one is a high ACE score means that a child will experience negative outcomes later in life. Is that a fact or is that a myth? Myth, 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 myth. Good job. You guys are listening, listening and learning. This is not true. Okay. The high A score is a risk. It's a look at their risks in the future. And so there is a correlation between the two, but there's no causation. There's absolutely no path that can 100% predict your negative outcomes related to health as it relates to your A score. But it is something that we want to be aware of. Number 3 is one stable relationship with a caring adult can meaningfully support resilience. Thank you. Fact, fact, fact. Yes, you guys are correct. That is statistically significant. Young people with high A scores who have at least one caring and meaningful adult support in their life can significantly increase their resiliency, which is correlated to their health outcomes in the future. It's really important to know that. All they need is one. Number 4, building resilience means teaching children to cope better with their difficult circumstances. I see fact. I see it. It is a trick question. It's a little bit of a trick question. It is true. In resilience, we are teaching children to cope better with their difficult circumstances, but it is not completely on just the young person to manage their own resilience. We want to make sure that we're giving good opportunities for them to meet high expectations, take safe risks, learn from mistakes, have healthy interactions with adults, and teach them coping skills, sure. But that is the trick part of the question. The question isn't exactly inclusive of the whole picture of resilience. The last one is positive childhood experiences can support better outcomes even when adversity has occurred. Yes, I love the energy in the chat. It is absolutely a fact. So positive childhood experiences can better support outcomes even when adversity has occurred. That's the good news. And I want us to keep that in mind, especially when you're having difficult interactions with young people. We want to look at and really tune in with what's going on with them, what's happened to them, and have empathy for how that can present itself at times, and really still being intentional about taking opportunities to assist in resiliency building. And we can go to the next slide.
Yeah, so now we're going to transition into that kind of case portion that I mentioned earlier. So what we'll do is Gwen is going to introduce a case to us, and then Allie will walk us through some discussion questions. As always, we'd love to have you guys interact in the chat, or if you'd like to come off mute, feel free to do that as well. I'll go ahead and pass it off to you, Gwen.
All right. Thanks, Haley. And thanks, Allison, for all that information. I feel so much more uplifted after I'm like, here's the hard stuff, and there is such potential. So let's talk about that potential with Jordan. Jordan is a 10-year-old fifth grade student, very appropriate as we head into back to school season here, who has recently become increasingly withdrawn in class. Over the past several months, Jordan has frequent emotional outbursts, has difficulty concentrating, and has been sent to the office multiple times. Attendance has become inconsistent, and Jordan often appears tired. You learn that Jordan's family has experienced several recent challenges, including parental separation, housing instability, and a caregiver struggling with substance use. Jordan's teacher shares that despite these difficulties, Jordan lights up during art class and has developed a strong connection with the school counselor.
We can go to the next slide, and we're just going to interact with each question just one at a time. Like Haley said, you can come off mute if you wish to. You can also put your answers in the chat. The first question is, which experiences in Jordan's story might be considered adverse childhood experiences?
I'll just say I dropped the description of Jordan's case in the chat too. So if you guys need to look for some details.
Thank you. Yes. So you don't have to have stellar memories. So I see parental separation in the chat, substance use disorder. Yes. Good job, you guys. Those are absolutely things that would potentially be counted as adverse childhood experiences when Jordan would be completing that assessment.
Yeah, and I think, Julie, your answer of possible emotional neglect, I think that's the kind of stuff that we just stay aware, right? So there's anything in there is like something's going on with them, and we don't really know if Jordan's emotional needs are being met at home, but just an awareness that there might be more going on than what we absolutely know is really helpful.
The next question being, what signs or behaviors may reflect the impact of chronic stress or adversity? I see often tired. That's absolutely one. Withdrawn, emotional outbursts, dysregulation, absent from school. Yep. I think you guys got them all. Good job. Appreciate the interactions in the chat, you guys. Those are definitely going to be signs that may reflect that Jordan is experiencing chronic stress or adversity. Those in and of itself, but certainly any just like changes in behavior, like changes out of the norm. So Jordan usually does A, B, and C, and coming to school and presenting differently, like that would be, an orange flag. Like we need to lean into that in the school setting or a setting where safe adults could present and make sure that we're helping to build resiliency during that adversity. So, in your current role, what additional actions could strengthen a student like Jordan's resilience and support healthy development? Looking for maybe some specific examples, if you can envision yourself in Jordan's kind of sphere of support, what might you do?
Is it okay for me to come off mute?
Yes, of course. It's a preference, actually. Love to chat.
Hi, good morning. My name is Layla. I was thinking that there's two pieces on the resiliency part. So Jordan is enjoying art and is building a strong relationship with the counselor. I think the counselor should maybe loop Jordan into a weekly support group if that's appropriate or the school provides it, or just having one-on-one meetings on a regular basis. And then I know not every place has this, but where I am in Douglas County, Kansas, I think we're all Kansas. We have an arts-based program called Van Gogh, and they specifically look at children, teens with higher needs, maybe at higher risk, and use art and independent living skills with a lot of amazing social, emotional learning and supports. This make believe Jordan seemed like a perfect fit for Van Gogh in my mind, but yeah, that's my 2 cents.
Awesome. Thanks so much. Looks like there's also some recommendations for a mental health referral. And then someone said, in my current role, I would support the counselor if she had secondhand trauma and educate his teacher on what's going on and how they can support, which I think are great ideas. That secondhand trauma could totally do a whole session on that. So thank you for calling that out. Increased interaction, a daily check-in, check-out with the counselor. And someone shouted out Van Gogh. They're familiar with the program and it's a great program. So thanks for naming that. Anybody else want to be brave and come off chat or come off mute and share with us what they might do in your current role to help Jordan? Okay, no pressure. Okay, our fourth question. How do you imagine your own ACE score impacts your support to youth and children? And so in this question, we certainly aren't asking for any disclosure. You do not have to share your ACE score. But this is just kind of reflecting back on self. We're human and everything is fluid in our interactions. And I think this is an important question. So thinking about your own ACE score, how do you think that impacts positively or negatively how you support youth and children? Layla said empathy and modeling resiliency, which I think are fantastic. Understanding, more tuned in emotionally than some staff. Yep, that's great. That's a great thought. I think it would bring up wounds if you're not healed from them, or you could be sensitive to their situation. Yes, totally agree. In the past, it's put me into a freeze state and I haven't acted as fast enough. I regret this and I'm trying to do better. Thanks, Julie. That is very honest answer, and I think is really helpful for other people in the audience to hear that. Fortunately, Jordan wouldn't be eligible for Van Gogh as it serves as a start with 14-year-olds. Thanks, April.
Mhm.
Meeting
I
them
think
where they are and bringing them up. Yes, sorry, someone else.
no, that's okay, Allison. I just think when I do this train a lot, I often tell people, so if you're, again, without disclosing numbers, if you're a 2, how do you interact with people that are 8s? What does that look like? Can you understand, like, oh, somebody might have different experiences, might be showing up differently to this, even as adults, right? So somebody mentioned, I'm going to support the counselor and the teacher. So adult to adult, how are we handling this based on our ACE scores, based on our life experiences, based on what happened this morning before we got to this meeting, whatever that is, right? That's kind of that approach to being curious about each other. And so I love this question of thinking about what's going on with me. Either I have a low ACE score and I really don't understand what it's like to have a very reactive, personality, a very reactive behaviors, those kind of outbursts, or I am very reactive and I don't really understand, maybe a teacher who isn't responding in a certain way or something like that. So I think that self-reflection piece is always real important. So I'm glad this got in here. Good stuff.
I know we still do have a few more minutes, maybe for 1 to 2 questions. So if anyone has any questions that they would like to ask Allie or Gwen, again, feel free to come off mute or you can type in the chat.
This is Kendra. I don't really have a question, but just a statement, I guess. I'm a therapist that goes into the schools and I see kids for mental health therapy. And sometimes like just realizing like, hey, one supportive person can really influence a lot of that resilience and help them. I think is really helpful because sometimes like whether you're a teacher or a nurse or whatever, you can feel really overwhelmed by kids' experiences and feel like you can't do a lot. But then when you can remember like, hey, I can be a support to them, I can check in with them. There's so many kids who say like, oh, I love this teacher. And literally all they do is like high five them in the hallway every day. So it doesn't always have to be like a huge thing. And so I just think that's really helpful for people who can get overwhelmed by ACEs or maybe don't have all the clinical background as like a therapist would. So
Yeah.
Yeah, that's fantastic.
I think that's a great point. You know, in my previous employment, I had the privilege really of working there for 16 years. And it was, some young people that I met in 2010, I was still in contact with when I left in, 2026, and they're full adults at that point. And just hearing them kind of recall the moments that were extra special to them during their services. And it's things that, would make me feel a little guilty because it wasn't something that crossed my mind. When I think of the big things when I'm impacting young people, and they just remember that one time they had a job interview and they really needed to do laundry, but they also had so many other things to do. And I agreed to move their laundry from the washer to the dryer because I recognized that something in their life was really important and I could help them with that. And so I do think, Kendra, that that's a really strong point that we should underscore is that something that might seem small to us can change someone's week. It could change someone's month and really impact them differently. And so, in some ways, that takes the pressure off. Like, we're just being supportive and being helpful, taking advantage of big and small moments just to provide that impact to the young people.
Yeah, that connection. I mean, that's what that is, right? That's like I've made a connection. It's not always a life-saving. Sometimes it can be life-saving in ways, but right, that high five, that check-in, that just those little pieces are you matter to me. That's what that says. I changed your laundry says you matter to me.
Thank you all. I appreciate you guys sharing that and Allie giving that specific example. I did want to shout out to Cody had shared in the chat that she had a colleague with a higher ACE score and they taught trauma education and ACEs together and that she was able to learn a lot from her, given that the coworker was able to relate with individuals they taught with, and just how commented how resilient of a person she was. So just wanted to share that. And thanks, Cody,
Awesome.
for sharing with the group. Right. Well, thank you guys for the question and the interaction. I think we can go ahead and go to the next slide. And just to wrap up the session, we are going to have Gwen and Allie kind of share their take-home messages for you all to continue to think on. Go ahead and start.
Yes. Yeah, I think when you look at those first two, especially now having been through the whole training, they even land a little bit differently, right? So ACEs can affect, not an absolute, they can affect health, behavior, development, well-being across the lifespan. So the risk of negative outcomes increases with ACE scores and exposures to those childhood experiences. But it doesn't really, it's not an absolute, right? So it really is based on what somebody experiences and then how they are, how resiliency is placed into their life, what opportunities they have for those connections. So for me, that's always what matters is what is your ACE score so we know what we're starting from. I think Allison said, like, your ACE score never changes. If you're an 8, you're an 8 forever. Those experiences happened. It's what you do about them and how we help manage. So that's what I take away from the first part of the training.
Great. And for the resiliency part, it's just we want to make sure that we always know that there's hope with resilience, and resilience can be intentionally strengthened. Positive relationships are among the most powerful of all of the protective factors. I know we said it, but I'll say it again. It just takes one person. And every support action, no matter how small, has the potential to create a ripple effect and change a child's future. And that is not overstated at all. Relationships are powerful. They can counteract high ACE scores, those experiences that children had in childhood, and can positively impact their health as adults. And that's true, and it's important.
Thank you guys so much for sharing those with us. I do just want to say too, thank you, Gwen and Allie, so much for sharing your expertise and your experiences today. I know, Gwen, you got us through the hard part, and Allie, you uplifted us at the end. So I just really wanted to give my appreciation. I also want to say thank you so much to everyone in the audience who joined us. I know this is a busy time of year for a lot of you getting back into school, so just excited to see so many returning, but also new faces. So before we wrap up, I do just want to give you guys an opportunity to provide some feedback on today's session. So we have a QR code on the screen, and then I will also drop a link in the chat. This will just give you an opportunity to access a brief post survey. And really, it's your opportunity to share kind of your thoughts and experiences for today's session, and as well as our two speakers. Next slide, please. And really quickly, just want to highlight our next session in the series is going to take place on August 27th at 12 p.m. Central. We will be discussing how to support adolescents through vaping cessation. So we'd love to have you join us as Dr. Ollinger and Ellie Levins dive into this topic. As for today's session, you guys will receive a follow-up email that will have a link to that feedback survey, a copy of the slides, as well as some additional resources and a link to the session recording. And then we will put out certificates of attendance as well. Just give us a little bit of time to process those. But I just want to say thank you guys again for joining us and really hope to see you next time on August 27th. Have a good rest of your day.
Thank you. Bye.
All right. Thanks, guys.